Hello, this is Eric Michael Lloyd. I have a master's in neuropsychology, clinical psychology, um, neuropsychology concentration. Today I wanted to read a little bit from an article on www.sciencedaily.com. This was released in January, the 22nd of that month, 2021, from the American Society for Microbiology. Summary: new research shows that non-steroidal anti-inflammatory drugs, NSAIDs, reduce both antibody and inflammatory responses to SARS-CoV-2 infection in mice. So this is piggybacking off of what I read, an article from or statement from Dr. Fauci that echoed these findings about the use of NSAIDs, non-steroidal anti-inflammatory drugs, and how they could suppress immune response if taken um, before the second dosage of the Pfizer vaccine. Or I'm not sure if it was any vaccine, but I'm pretty sure that the mechanisms probably work the same, meaning the vaccine's ability to produce a response for a protein, a certain protein, P spike, I think it was called, to produce the immunological response. So it reduces the immunological response, according to what that doctor said, Dr. Fauci, and also other researchers as well. This article talks about that in a little more detail. It says new research shows that non-steroidal anti-inflammatory drugs, NSAIDs, reduce both antibody and inflammatory responses to SARS-CoV-2 infection in mice. The study appears this week in the Journal of Virology, a publication of the American Society for Microbiology. It goes on to say that NSAIDs are the most commonly used anti-inflammatory medication. This is Craig B. Willen. He's an assistant professor of laboratory medicine and immunology, Yale University School of Medicine. People take them for chronic conditions like arthritis, sometimes for short periods of time, or during acute inflammation when experiencing COVID-19, or for side effects like the fever, malaise, the soreness. Dr. Willen suggests that the NSAID meloxicam dampens the immune response to SARS-CoV-2 infection. The research also suggests that consequences of NSAID use during natural infection and vaccination should be evaluated in humans, said Dr. Willen. It talks about the research and the data, particularly in the clinical trials for vaccines, exists, so it should be mined to see if it produces antibody responses in people. A quote from Dr. Willen: taking NSAIDs during COVID-19 could be harmful or beneficial, depending on the timing of administration, said Dr. Willen. The potent anti-inflammatory dexamethasone, not an NSAID, is detrimental to COVID-19 sufferers when taken early in the infection, but beneficial when administered during later stages of COVID-19. Similarly, NSAIDs' anti-inflammatory activity might be detrimental early in SARS-CoV-2 infection because at this stage, inflammation is usually helpful. It changes at later stages of COVID-19, particularly if the patient undergoes an intense inflammation known as cytokine storm. Cytokine storm is an immune response of inflammatory compounds that occurs in COVID-19 patients, can lead to complications, need for intensive care unit, and even death. A reduction in neutralizing antibodies caused by NSAIDs might be benign, or it might blunt the immune system's ability to fight the disease during the early stages of infection. It could also reduce the magnitude and or length of protection from either natural infection or vaccination, said Dr. Woolen. Lastly, it states that Dr. Woolen says, it seems suspicious to us, so we wanted to investigate it. Furthermore, the next statement, in fact, we initially didn't even carefully look at the antibody response because we didn't expect it to be altered by NSAIDs. This turned out to be wrong, said Dr. Woolen. So that's the end of that article. The Dr. Woolen, I guess, stands corrected, right? But which is typical in science and medicine. You put out a hypothesis, and they test that hypothesis to see if it's correct, and if the evidence, the findings support the hypothesis, and if not, they change the hypothesis or alter the theory. So this is the process by which science and medicine, which is a part of the scientific field, self-corrects. And Dr. Woolen basically, through those statements, demonstrated that process. All in all, NSAIDs could, like the title suggests, exacerbate or suppress COVID-19 depending on timing. This is from a mouse study that suggested that, and this was in the American Society for Microbiology, January 22nd, 2021. Thank you for your time.